Right. So how are kids doing, by the way?
I think each one of them are still on their journey, you know,
I see.
and
If
I
you come a
think,
little bit closer, Carolyn, I think you're
yeah,
in a, yeah. Mm-hmm.
yeah, each one of our kids are on their own journey. And I think Liv and I, we're in the season now, we just kind of cheer them on the sideline because we can't really tell them, anymore. So we're
Yes.
more of a coach, and
I see.
we're available if they ever come, and ask or talk anything. But otherwise, we we believe that God has great plans for each one of them.
Right.
And
Makes
so
sense.
we just
Makes
have
sense.
to, step back and just let God works in their lives.
That's right. I think,
Yeah.
yeah, we want to hold their hand and, the kind of, we want to force them what to do and not, but it's not sustainable already then. Okay, maybe you're not on the same plane. That's why you're disappearing. You see your picture is coming and going. We're not in the same plane. Maybe you have the blurred background.
Oh,
Yeah, okay.
oh yeah.
Can you see your own video?
And you,
Yes,
yeah.
yeah, I see the video. Oh, but I don't know why. Yeah,
Why
So
blur?
if you can unblur, I mean, just video, click on the video button, I mean, yeah, side button options. I think, if you wanted to, did you want the blur of the background? Is that what you wanted?
we don't have to. So how do I do it? Do I?
Okay, so there will be an option on the video, like a microphone on the video. There's an
It's
arrow.
called stop. Well, actually, I see the video. It says stop video though.
No, no. We can, there's no kind of extra menu button on the video next to that.
Reaction, whiteboard, participants.
So right now it's on the video, what do you call the blur my background option. If you're blurring, it focus on one object. So it's focusing on limb right now. So Carolyn is blur.
Notes, share,
Yeah.
chat. I'm sorry. More. I'm gonna try to see more.
It should be.
I'm looking background effect and no blur.
Yeah, you got. Oh yeah, now that's it. You fixed it. Okay, because you have an awesome background. You don't have to kind of blur it. So, all right. Anyways, thanks about the, yeah, sorry for that distraction. So, okay, so basically, let's see.
Is that good, right?
Yeah, it looks great. It looks great. And then you guys are actually going to look much younger. Okay, let's get back. So, if you want, I think, let me just kind of share my screen to kind of get up to the speed and give you an idea. All right, what do we see now? You see Lynn's slide?
Yes. Yep. I see
Okay.
the screen. Yes.
That is just to kind of, give you a little sense of, time travel, right? So both of you all, maybe you can just kind of, you don't have to be, too structured, but what was that? What was that kind of inspired you all to, try our program? What were the pain points or kind of what made you concerned? Like, I got to take care of my health, and then let's give it a shot and see, what we can get out of this program.
So basically, for us, we know that we're about to become empty nester, and that means we're gonna have more time to travel, to spend time with each other. But to be honest with you, when we look at ourselves, we got tired all the time, and we just didn't know, and was frustrated to try to figure out what happened to our energy. And so that's what that was our number one motivation of why we need to join the program.
And it is true that we're looking to do more things because at a certain point I'll be slowing down. But I've found that when people when they at the age of slow down retirement, they can't do anything. They're getting sicker. That part, and we didn't want to do that. We want to be healthy as we get older, not sick as we get older. And so Caroline actually was the one who's talking to you more, even though I work with you, but Caroline is the one who talk to you more and then explore more.
Well, unfortunately, yeah, feeling that we all live in that invisible cage. We don't realize, how we are doing unless the outsider can see, right? So basically, what I'm hearing is, it's not that we were diagnosed with diabetes, blood pressure, or some kind of bunch of medical issues, but slowly, our energy levels are going down. And then also looking into the future, we don't want to get into those kind of patients end up in nursing homes, right? Having these, back-to-back problems makes sense. I know you.
I think to be fair, Dr. okay, is I was pre-diabetic. And, you know, without going there to see you and run the test, definitely I would be a diabetic. So a lot of time the visible sign might not show up, but I do believe it, as a result of being pre-diabetic, that's also contribute to the low energy and everything else.
Absolutely, absolutely. In other words, you're right. I mean, pre-diabetes itself, if you're not testing yourself, you might not know it. Even if you do, there is so much going, under the surface, and that's what actually slowly eroding your health. And you prevent it. In other words, you prevent yourself, falling into diabetic phase. Makes sense. I know you're a physician yourself, Dr. Du. So and we know we read the science and we have been seeing patients and we know how, people can go down the hill and we have been managing. And then you even see patients in the inpatient now in the hospital setting as well. But did it ever kind of, bother in the sense, even raise the concern or that, I don't want to see any of this, or what actually made you more of a, raise the alertness about, you need to kind of take care of yourself as well?
So as physicians, I've been doing medicine for 30 years, and there's several trends that I noticed. The first one is that our patients getting sicker, more disease at younger age. And every year they keep taking more and more medication. They live longer, but they're taking more medication and not necessarily healthier. I also we are seeing all these diseases now getting to our children and the young kids too. And I have not seen a change in the trend. And what was really sad is even without experts, they don't have solution either. So I'll give example of last year. Caroline went to a conference by our own endocrinologist, and it's an international conference inviting guest speakers from Mexico, and they were so proud because they were talking about obesities, but all they can show on the graph was obesity is that obesity getting worse every year. They have all these wonderful medicine, but every year they have more obesities, more disease, and they have not reversed the trend. And that's what I'm seeing even now on when I was practicing medicine, and is that we have not gotten healthier. So now I'm challenging our patients to challenge their doctors to ask the questions. If you've been taking care of your patients in the last many years, how many of your patients can you say they're getting healthier, taking few medications? And if you're not doing that, then why not? And so we need to challenge back ourselves and have our patient challenge back their physicians all to do that. But
Absolutely.
we need to change that.
In other words, when I started, I ask in the crowds when I, give these, open, community talks. So yeah, the one question I ask him, how many doctors did you have in your childhood when you're little? It could be in a little village or town or city. How many doctors did you have around you? How many hospitals did we have? How many specialists or how many medications did you have then? And how many people were sick? So typically what I hear, the answer for everything is less. We didn't have many doctors. We didn't have that many hospitals. We didn't have that many sick people either. Turn around and look around today. How many doctors do you have? How many clinics and hospitals and specialists and labs and the medications, right? Then what's the disease level, disease burden in the community? It is exponentially, multiplied like 10, 20, 50 times. So that's a clear paradox. We have more physicians, more science and technology, more medications, more genetics and, gene-based testing. But at the same time, this is where the highest level of disease burden. So that's backwards. If we have more doctors and more specialized, all the diseases should have actually disappeared, right? We all should have been. So meaning our focal point is somewhere else, right? Too many diagnostics and therapeutics, but if that's not where the trouble is, and I don't think we'll ever find the solution. So I think that made people, everybody listens to our talks in the community. Now I think at least there are 10, 20% of people are like, we got to do something different other than, just to keep popping these pills. Anyways, so that's good. But okay, let me just kind of share the card, and then I think we'll go from there. So let's take yourself to what kind of experiences you had with the weight. Did you try any weight loss medication or program, by the way?
I've never tried weight loss medicine or weight loss program.
So what was your expectation in terms of weight? How was it affecting your kind of basic quality of life before starting the program? And then what kind of changes you saw in terms of weight?
I think for women, our image and how we feel about our body integrate and affect everything, every part of us. That's what I find among my girlfriends and females overall. So losing weight, I mean, just give you an idea. I was able to go back and wear clothes that I had in college, and so I was excited. I mean, just that alone. And so I feel like at the beginning of the journey, you're just like, okay, kind of hope if even just work, but I was skeptical, to be honest with you, because I think on my own, I did try different weight program for me, or, just different things. But those things, I mean, it's more like trendy stuff. It doesn't really give the long-term foundation. And so when you start to educate us, introduce to us and truly explain how things work, I mean, it totally opened my eyes, like, and then with
Excellent.
that, you pretty much unlock, the possibility.
Excellent. Excellent. So we saw about, 15, 20 pounds down in you, Carolyn, and about 30 pounds down in the you, Dr. G. So, okay, so kind of take a couple of seconds to kind of, speak in those numbers. What was the change in your weight, Dr. G?
As for me is concerned, I didn't expect it to change that much weight, and it was that was amazing that we could do it. And actually, I got down to my high school level weight, and it's not, and yeah, it is true that a lot of more women look at the weight and they more emphasize. But I was very surprised. I'm very happy to get down to my high school level. I got rid of 85% of my clothes.
That's the only down.
That's the only down.
Okay.
I got rid of
80 something wardrobe.
80 something pairs of my clothes, but it's actually now look better, feel better. So I think that make a big difference for me. I did not expect. I was expecting a bigger battle fighting of how to lose weight, but I think the way you approach, instead of trying to take away the bad thing, is trying to eat more of the good thing, and slowly, as a self competitions, you check, oh, today I'm 2 leaves, 4 leaves, 3 leaves, and then just coming back every week to remind, let's do this. It's a stepwise. It's a daily, not just like one moment and then you have to be changed. That make a big difference. I think 6 months that make a big difference for us to start changing the behavior and slowly crowd it out, the bad stuff, and just emphasize more the good things, eating the more.
Oh, sounds good. I just gotta put up the slides, and I don't know if you can see this on the screen now. Both of y'all, if you can just hear the numbers, in your words. How much did you? Overall, how much weight do you think you lost? And then Carolyn.
I was almost 140. I was down. I think the last time was like 123.
Wow. Okay.
I think I lost somewhere is at least 25 pounds. I went down to as low as 147, which is less than BMI of 25%. I do know that. And at the same time, not just losing the weight, but also gain the muscle mass, which is very, very important.
Which is important for all. I think, you both reverse your insulin resistance and reversing insulin resistance and then again, as we age, there's sarcopenia. So there's a natural tendency, or actually a pattern to lose weight over time, but we need to bring it back. All right, just let me hear some of the sound bites in terms of prediabetes. I think we officially kind of saw your A1C down into non-diabetic range, Dr. Dew. Just a few words in your words. Just gonna try to use those terms. Reversal of prediabetes to non-diabetic, and
So,
also on the cholesterol, and speak in terms of medications. If you started anything, or you didn't take anything, or are you on anything? As we say, zero cholesterol, zero blood pressure, diabetes meds.
so starting the program, I did not take any medication. However, with this program, I was able to drop the A1C down to within from pre-diabetic down to within the normal A1C range. The cholesterol actually did also drop, which is also good. Blood pressure drop. My blood pressure systolic was into the 110s, 100 to 110s level, which is very, very good.
Absolutely, absolutely. Okay. And again, because of the risk in the family history of kidney issues and kind of single kidney, that was a little bit of high risk situation. I think if you look at these numbers, if you look at this diabetic markers in the top, are you able to see my slide right there? All into the greens.
Actually, I don't see the slides. But thank you. Remind me about the kidney. Actually, a few years ago, probably 6 years ago, I donated my kidney, and so my kidney function was not as good as optimal because of that. However, I noticed that when I started doing the whole food plant-based, actually the kidney function is actually much improved. So that is to me, it was a big part, and it is not just me. I have another one of my MA. She also have a kidney function problem. She have CDK3, and when she started doing, she didn't do a whole entire thing whole food plant based, but by listening to me, she started eating more fruit, more vegetable, and her EGFR actually also was all improved. That would make a big surprise to her doctors also.
Sounds good. Yeah, this is the slide I was looking up to. So on the top, your diabetic markers all turn into green. So pre-diabetes into non-diabetic, and your kidney function, serum creatinine was 1.25 down to 1.0. And the cholesterol, most of these triple digits into double digits. Your inflammation, 4.0 down to 2.7. So it's almost like a 40% down. What do you think? How did they make you feel? Even though you never had a diagnosis of diabetes, cholesterol, heart disease, or kidney issues, but how does it make you feel as you're aging, and then you're as a donor with a single kidney right now? How does it make you feel flipping all these numbers across the board?
Make me feel younger, which is good. I'm actually, the only thing I wish is that years ago I would have done some sort of a calcium score for my coronary, because I want to look at, after a few years of whole food plant-based, whether that would convert my calcium score. But unfortunately, it's too late now. But that's the other thing I'm looking for, is not only these diabetes, blood pressure, cholesterol, but also in long term, it's also going to benefit with the GI symptoms, with any inflammatory markers, but also in terms of coronary, heart texture, and even cancer itself, that I'm looking forward that over time it will also to be a beneficial for me also.
Absolutely, absolutely. How about gout? Any thoughts or any experiences because even though that was not our primary target, as we say, underlying root cause of inflammation is something across the board. How did it make a difference in terms of your gout?
Gout, as far as gout is concerned, is better. I still have problem whenever, because of contaminating food, not because of the food itself, because I'm eating, avoid those things. But whenever you could go out, there's contaminated. When they cook in the back, we don't know anything about it. It does that, but by itself, it actually helped out with that also. So that was also good.
Excellent, excellent. Okay. Already then. I don't know. I mean, if any of your friends or family noticed any change in yourself, of course, so you can talk to yourself in the mirror. But are we hearing anything from your friends or family? Any kind of changes in, you guys are looking sick? or looking tired or looking different or have some energy, high energy, low energy? What do we hear?
Um, I think overall is very, very positive.
Mhm.
The difficult part for them is for them to imagine that they can do the same thing.
Mhm.
That's the difficult. And I said, no, it's not that. I mean, if you just do this, try this, do this, and they can do the same way. Um, I think most of the time it had to do that you have to have a system like the way you do. That has to be part of the system. Everybody knows it. Everybody knows what to eat, what to do right. But unless you're part of the system the way you did it, where you help us, where you eat the right thing, come back, make a little adjustment, continue to make adjustment, and keep doing that, and motivation and coaching along the way, people can do this. And so, but there was positive. People were just really positive, and I've been pushing the yes, you can do this too.
Okay. I think yeah, kind of you're getting onto the monitoring part of the system. In other words, as you said, we probably know, what's right, what's wrong. Details can be confusing, but execution is the challenge, and accountability, and then staying on track. How do you think our monitoring systems, your blood pressure or weight or any of the metrics or apps that you use, and the data that we would review from appointment to appointment, how do you think our monitoring system and accountability system can help you to stay on track and get the results as much as possible?
For me to monitor, anything you monitor will improve, and so that will help me to be true to myself in terms of
Or
weight,
keep us accountable.
weight, blood pressure. Okay, so that's always accountable. That every week we have to come in and say, hey, how many green leaf are you? And we have to accountable for that. So it's good. I also like, as far as the term of the app is concerned, not only it shows us my blood pressure, shows my weight, but also what is important is that it's actually show my age and my health age. When I first started, my age is like 2 or 3 years above what it should be. And when we start this, it's actually 2 years younger, which is good. It's also showed me the Framingham risk. Before I got started, I was above the average Framingham risk for my age group. And after I started, it's actually lower on my Framingham risk. And I think that's the thing that's important, because most of the uh, any weight loss program out there, people will lose weight. People will get a blood pressure better, cholesterol better. But I say, but can you show that your Framingham risk decrease? And they can't show that. They can't show that. With this one, you can actually see in real time that your Framingham risk get improved. And
Even you're referring to the heart attack risk and all that.
That's correct. So that's a challenge that I have for them, and they cannot do that.
Makes sense. All right. Yeah, again, what we learn in the program is not just something to kind of follow to the letter, because it's the reality is different, and then we need to adapt, kind of put into practice as much as possible. On that note, what were the struggles? In other words, were you trying to kind of make everything perfect, and kind of what we learn and what we are asking you to do, or how did you translate? How flexible were you, or were there any cheat days, and how are you making up, and how are you keeping up?
I think at the beginning we thought it was hard because, of course, I mean, the first couple of visits we didn't meet the goal, and we got a little discouraged. But I truly feel like you and your team remind us, say, hey, it's not about the result, but are you making progress? And that's when we have to reshift the way we think. Say, no, we on in this program for the long haul. It's not like, oh, did I lose, 5 pounds from last week? That's not what it's all about. But are you getting the discipline and mainly changing our behavior and our thoughts process of what, how we see food and what do we put in our bodies and all that. And so I think that's more of a long-term gain and transformation.
In terms of coaching, the label reading or any kind of, how did it impact your label reading sense and, grocery shopping? Are you kind of just blindly picking the stuff that tastes good for you or you want to go for, or how did it change the way you shop and then cook and eat and when you go to restaurant as well? How do you pick the menu? How did it impact?
I mean, it helped us to be more intentional, versus before. I mean, to be honest, it's just like we didn't know what we didn't know until, you and your team educate us on how to read the label and then also compare, because we tend to gravitate, it's like, okay, well, this tastes good or the package looks good or, but none of that's got nothing to do with, what's really good for our body. And so that was a interesting, but also fascinating part of the whole education that you offer.
One of the things that's very interesting, people always complain about when you do whole food plant-based that it can be hard to shop and all this. Actually, we found it's actually the reverse. Because now instead of having to walk all over HEB, we're only one section.
Right,
so,
right.
so technically we're only one section. There's not a whole lot. So we don't walk all over HEB. Our shopping is much faster now.
Unless we want to put in our steps.
So to me, it's actually much simpler in terms of shopping. The other thing is that there's grace in the process in the program that you modify. So one of the other things that I hear is that, well, people can do this, but when they get together with their family, they can't. So what we did, we just modified. So our favorite restaurant is still places like Marciano, but I don't eat the stuff that they do all over the place. I also very modify what I eat to do that. So that's helpful. So it's not like we cannot do this. So we just modify and the family knows. And so, okay, when mom and dad come, they have their section and we're going to order our own section. So it make it easy that way. So you can change into life.
And also the feedback that we get from friends is, I think a lot of people are misinformed, including us at the beginning, because we thought, oh my gosh, now we have to give up our favorite dish, our favorite food, but it isn't so. So again, I mean, just like a lot of things, you just have to walk out on faith. And it's like, hey, if you're sick and tired of where you're at, then you got to do something about it. Otherwise, nothing's going to change, And I think a lot of time, even you might be in the profession, but you still could also, if you don't know what you don't know.
Makes sense. In other words, our kids, both of our kids, now 10 and about 14, almost 14. I'm going to say, they're not 100% plant-based. They do still have, lamb and fish and chicken here and there, but we teach them the add-on philosophy. Okay, but where are the greens and veggies and fruits? So we buy every week. We have a favorite list, just to repeat. Of course, we change, categories, fruits and vegetables, but every week they come in and then they get emptied. So that means they're going in, right? So they're consuming, and we want to explore food as well, because it's not just eating home, which can be good for sure, but we want to give a different experiences to our kids as well. So we almost go to a new restaurant almost always. Recently had daughter's birthday, wife's birthday, and then our wedding anniversary coming up. We go to different places and they want to go Italian, I think last week or so. And we said, like, we in the recent times, we went to Olive Garden, and then even my kids started realizing it already has a ton of cheese. And the guy wants to come and then, kind of sprinkle some more cheese on it. And then they started calling it all cheese garden, not Olive Garden, because it's hard to find an item. Even for me, I modify a lot of stuff, and then we try to find, but it's hard for my wife and myself to find something without cheese. So we ended up going to a different Italian restaurant. They love the ambient, they love the food, and then now we teach them how to talk to the waitress too, and then they're on the show. I mean, we want them to kind of place the orders, and then again we went to downtown, one of the Latino Mediterranean restaurants. So they love the ambience, and we just narrow down the menu and then say okay. And they tell us, mom and dad, you can blindly go for this, and this, but we can try this and this. And then they ask each other, where are your greens? You better cover your greens and veggies, right? So, I mean, it doesn't need to be like a imprisoned to something, but end of the day, you got to compensate. All right, sounds good. Okay, we're gonna wrap up and see. There are a lot of people. I think we're excited to kind of hear more and more patients learning about our program. I think they're yearning. They're kind of looking forward to finding a place like this. We are proud. We are getting patients from Uvalde, Texas, Pearsall, Texas. Even somebody joined yesterday from Corpus and then Austin. So people are driving to come to our place. So we, excuse me, we open doors to televisits for them after the second month or so, depending on how they're doing. We're really proud of people kind of driving from different places, not just San Antonio. But there are a lot. There are many on the fence. What would you say? I mean, what was your thought process before even, trying this program? What does your new me tell your old me, or anybody who is on the fence? How is it worthwhile trying, or how do you think it's going to change from how their diabetes and obesity is managed in the traditional setting?
I think that's the magic question, and it's also very individual things for
Mhm.
everybody. I think for us, basically, we got to the point we got sick and tired of where we were with our health, and so we realized we got to do something because the definition of insanity is you keep doing the same thing but expect different results. And we realized that no, we try that, but it didn't work. So when we heard about your program, I mean, to be honest with you, I told Lim, because of course by that time we don't know all it entail, and
Mhm.
until you join the program, you go through it and you complete it. But basically I told him, I was like, what do we got to lose? We
Mhm.
just have to check it out. And
Mhm.
once we got through, I was like, oh my gosh, how come we didn't know about this? And even Lim was in the mess and for a long time. But again, everything changed. The way they process food now is different than 10 years ago, 20 years ago. And so a lot of time we still use the same old thinking and keep doing the stuff, and we expect different result, which is, it's on us. And so a lot
Mhm.
of times just have an open mind. I mean, if you are where you need to be and you're happy, you're satisfied, great. Maybe this is not the program for you. But if you're
Mhm.
sick and tired where every year you go to the doctor and say, hey, guess what? I have a solution for you. And that
Mhm.
solution is I'm gonna prescribe you another pill, you know?
Mhm.
and
Right.
and because I'm not in medicine, every time you read
Mhm.
those things, like, oh yeah, we'll take care of this, but there's a side effect on the other 99 stuff. Well,
Right.
you
Right.
need to ask yourself, is that really a solution or is it
Mhm.
just a band-aid?
Absolutely. Yeah. In other words, I hear this. People are actually signing off from a lot of online programs because there is a kind of some recipe place, or maybe there is a dietitian or nutritionist, or maybe there is some kind of weight loss program or something else. But people are gravitating to our program because this is one stop place where there is a nutrition, a physician, labs, prescription. And even we are proud of some of our patients coming from endocrinologists, some of the leading endocrinology groups.
Mhm.
Now we are proud of our type 1 diabetics, who are actually teenagers and youngsters coming on their insulin pumps as well, because they were it's heartbreaking, that they're on these pumps, but they don't know why the sugar roller coaster is going up and down 300-400s. So, and this is it's hard to find a place where there's a physician, there are labs, there is a clinician and a fitness environment, and then the dietitian, everything happening under one roof with one coordinated action, and the monitoring happening at the same time. So what would you say, Lim, to those who are actually on the fence? Um, um, hmm,
What I would say is that the first question that people have to ask themselves is number one, do I want to change? Because if you don't want to change, there's nothing I can do for you. However, if you want to change, that is good. Then do something. Now, whatever you do, whether you want to do Ozempic, you want to do whatever it is, but show it. Which means put down what's your A1C today, what's your blood pressure today, what's your weight today, what is you have GI symptom, do you have arthritis symptom? Put all those things down. and do whatever you want to do for 6 months, and then say, okay, where am I? If you do that and all of those markers got better, then keep what you're doing. However, you do this after 6 months and your A1C was not good, blood pressure was not good, you'd have GI symptoms, you're still moody, your sugar still fluctuate, then you go in the wrong direction. Then you need to stop and say to yourself, I'm going the wrong direction, and do something else. And in that case, and one of these days, you may come to the point and say, hey, let's try this. And then do this system, because then in your system, you have support. You have to go through, and again, test your system out. Beginning, blood pressure and all that, and 6 months, here we go. For us, when we do that, our number and everything else get improved. And so that's all I can say. But most important, do you want to change? But then when you do want to change, test it out. Don't just do it and say I'm doing it and go blind and don't reevaluate. You have to reevaluate yourself whether I'm not going right direction, wrong direction or not.
And I think that's what's cool about your program, Dr. K. It's not the appearance. So, like, I told you, like, for me, I joke about this, like, yeah, I want to look good on the beach, and yes, okay, we can achieve, but I think the numbers, I mean, you're very evident based, and that's what Lynn's talking about. If the numbers, so you get more than just, the appearance, the losing weight, but the numbers also speak volume. And I think that cannot take the place of any pills out there.
Excellent, excellent. I think well said, well said. In other words, that's one of our kind of philosophies of the mission's meaning, kind of our formula that you manage what you measure. And we use that approach in finance, in business, in economy, even actually if you look at the healthcare industry. Our CEOs are actually they don't go blind. They're looking at the numbers. They're looking at the bottom line. Are we making money or not? Are we advancing or not? Where are our KPIs, right? Our metrics. But even though it's a healthcare system, we don't apply that same approach to our own health. And that's why we are really big on these data. They're visuals at your fingertips. Actually, the patients who are truly diabetic actually really seeing the magnitude of the significance of those metrics or CGMs and everything. And that's number one. And number two, people want to do something under supervised care, coaching and everything, but they don't know where to start. They don't know how to run the show. And then as you said, this is experiential learning. That's one of the things. Nobody is here to kind of brainwash you and then kind of force you to do which way. You yourself will experience the results, and then you see the numbers going down. It should build the confidence, because you must build the trust and confidence in the changes. That's why not everyone is changing in the same way and getting the same results. Excellent. Well, thank you much. I think we have another person excited lined up next, but we appreciate your time, and I can as you said, in your relations and personal lives and everything else, this is going to be a journey because we are going against the stream, meaning that the system, the food industry, and then everything else no one is trying to make anybody sick or feel bad, but just we're not realizing our own systems are actually working against us, and we just need to open our eyes and see where is the exit door. How can I? In other words, we put patients in the CEO seat. You are the CEO of your health. Listen to experts, listen to all the sources, but end of the day, you are the one calling the shots and making the change, and then experience the path that is giving you the results, and then just lead your way. You don't have to be stuck with the medication or the one mindset, right?
Right.
How are you with your data? Because I love it, because for us, when I tell my testimony, I don't want a lot of medications, but how is your data? So I can say, look, with this one, I know the average drop going to be 2 medicine less, or whatever. How far are you coming along with your data?
Well, we have number of patients with now coming with the double digits, 10, 11, 12, 13 A1Cs coming down to 7s and 6s. We are kind of 2, 3, 4 drugs drop on the diabetic medications, and 1 or 2 in 50 to 70% blood pressure and cholesterol. We have about a handful of patients with 0 meds coming out of the program. And we had even insulin cutting down by 20, 30, up to 100 units per day less than what they did
So
before.
you have those data available so soon, or is that going to be take you a while to put them together?
And it might take a while. I think it's scattered. I'm challenging one of my Quest labs, and they're not discrete numbers are actually splitting out into individual charts. They're coming into their PDF charts, but I'm putting together. We have number of cases, at least 50 really good cases with these stunning results. We had patients with like I said, uncontrolled diabetes, coming down into pre-diabetic phase, and then pre-diabetes into non-diabetic. The gentleman I just know about 30 pounds drop, pre-diabetic to non-diabetic right now, and 50% down on the blood pressure medication. And he thinks I feel like I'm in 20s and 30s, not 50s,
Wow.
like his teenage. And his wife is diabetic on medications, and he's kind of partner. He wants her to kind of join now. And we had recently had somebody signed up because I have little psoriasis and I think I want to feel better. But my husband is the one actually truly diabetic. And then they attended our event, and then they said like, I'm gonna try, because he said, no, go try it. And because you read a lot online, so I think you can learn something from this program. And then after going back home, they actually changed their minds and said, no, 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 I think he's the one who would get the benefit now. And then he got excited and he joined, and a few other folks with them already. Their average is coming down. When you look at their food plates, it's stunning. It's like, for the first time in their life, they're like kids. And that's what kind of surprises me. People follow just like they're school kids, because we awaken the real emotional part of their brain. And then all the right food is around us. It just doesn't show up on the plate because we don't have that intention. Well, yeah, we'll get ready with the data.
But don't worry, we are so blessed. Both Lim and I were blessed by you and your team as a result of, I mean, we already blessed by your friendship before the program, but with the program, you even added extra, blessing for us. So thank you.
Yeah. I think we're in the right moment of time now, in terms of local and national, and even like UHS with these hospital. I think it's time to start introduce these, but in real hard data, because at the end of the day, like you say, all these people can make decisions. The top people make decisions on real hard data, so we can present it to them.
But also, suddenly, I mean, we hear a different talk now. Even with the new administration, they focused. I mean, the first time they start talking, all these food we need to ban or certain thing. And I said, why have you done that for the past,
Right.
20 years?
Well, in other words, my take is actually I take a little bit of a different take, because instead of demonizing anything and blaming, industry and whatever, like I said, I think my approach is nobody is trying to poison anybody. They just want to make business. Because they're in business, they just want to succeed in business, and they want to make money. And we are getting blindsided that in the same process. Because the one thing I say is people who are sitting in the top of those companies, the CEOs and presidents and founders, they are victims of the same problem too. So we are victims of our own system, not realizing I'm making business for you, you're making business for me. A doctor needs a dietitian or a coach, and a coach needs a dietitian and the doctor, and then he needs the drug, and the drug guy needs the same physician. So we are actually kind of giving business to each other, not knowing that actually, making ourselves in trouble.
The population is the collateral at the end of the day,
It
and
is.
so I think but I'm just saying that at the end of the day, it's still going back to the individual accountability. So you can't blame the system or anyone else, so
Yeah.
I think it was so eye-opening for us to go back to learn. It's like, even just you educate us like how to read the labels, I mean, we kind of thought we knew, but we don't know.
Well, even for myself, until I, we got into these details, because everything that we have, again, this is the, new me 2.0, 2.0 is coming up, but experiential. It's not just for the patients, but I myself was like, man, food. It's still, there are a lot of tricks in the way the labels are actually made. but unless you turn the box and go to the back, and then you don't know what you're getting. But we'll see. I think, we're hoping the next administration would actually shift the gears,
Right.
because we're completely living the zombie life. Yeah.
Yeah.
Well, thank you both for taking your
you.
time. I know you guys were traveling, but this Sunday afternoon, we look forward to talking soon then. Okay.
Yeah.
Thank you much.
Continued success. Thank you.
Bye-bye.
Thank you much. Okay.